Hello and welcome to this program. Every year on the 10th of December, we commemorate World Mental Health Day. And in spite of the pandemic, the COVID-19 pandemic, we will still commemorate it here in the Gambia and everywhere else. The World Health Organization and the World Federation for Mental Health are very much in the lead on this day to make sure that we pause, we think and we reflect about those who are coping with mental health matters. Now, to accompany me on this journey, we only have an hour. We'll try and get through as much as we can. I have to my immediate left, Mohamed Toure from the International Organization for Migration, IOM. Welcome to the program.
Thank you.
Mohamed is a reintegration assistant, and to my right I have Bakari Sonko from the Ministry, and you are the National Program Manager.
Yes, for mental health services.
For mental health services. And now, of course, you've heard IOM, you think, migrants and so on. So later on in the program, we hope to be joined by a returnee who will also tell us some of what they have to go through in dealing with mental health matters. And I must not forget, for those who are watching and you are seeing signing, we have Lamin Sonko, who is doing the signing for us. I mention him now because I always tend to forget that he's there, but not this time. So once again, welcome. And if I can just start with you, Mohamed. We all think we know about what mental health means, but if I could ask you, can you give us a definition of what it means to you? And also a kind of supplementary question to that, what's the importance when we're talking about returnees and their psychosocial well-being?
Okay, thank you once more, Ade. Mental health is a state of well-being wherein an individual realizes his or her abilities, it's able to cope with the normal stresses of life, and is being able to contribute to his or her society. So in entirety, the concept of mental health surrounds this statement. Furthermore, if you look at mental health and you want to disaggregate it, you have to look at the way someone thinks, sure. The way we think, our perception towards the stimulus around us, how we foresee things, how we analyze things that are happening around us, and the way we think is going to affect the way we behave. Sure. Because if you look at people talking, you think they are talking about you or they are planning to do something against you. Sure. That's how your mind will analyze things, and that's how you are going to react. And the way you behave, it's been commented on, or it's been judged by the society we live in. Sure. So you look at our cognition, our behavior, and our society dictate our mental health. Sure. And why is it that we are interested in the mental health or psychosocial needs of migrants or returnees?
Indeed.
The International Covenant on Social, Economic and Cultural Rights has identified mental health as part of health as a basic human right. Right. So to start with, this is something that we cannot leave behind. And for the past decade, there has been a 13% increase in the number of mental health conditions and substance abuse disorders.
Is that globally or
that's on the global consensus? Yeah, this is a global view, sure. And it's coming from WHO. And then there has been almost 20% of children and adolescents around the world have a mental health condition. Sure. So this is a huge number, and this is also a huge burden. And then we have seen on a global consensus, the world loses $1 trillion a year due to certain mental health conditions. So this is something that we cannot just ignore like that. There's a lot of resources that is being lost to mental health, which have been pumped into other developmental agendas. It can be pumped into education. It can be pumped into infrastructural development. So migrants, if you look at the Gambian migrants, if you look at returnees, if you look at their profile in the Gambia, most of them fall within these age brackets, sure. Between 19 to 29, 19 to 30, 19 to 35. So they have been into this journey, and they have seen themselves in war zones. They have been exposed to different kinds of torture. So when they come back home, their psychosocial needs is something they cannot leave behind. Sure. They will need economic assistance. Mm-hmm. They will need some other forms of assistance. Sure. But holistically treating them, you cannot leave their mental health and psychosocial needs behind.
So I'm glad you mentioned that, because I mentioned at the top of the show that the World Federation for Mental Health are leading on this. Yeah. And in fact, their emphasis this year is very much about investment in mental health, and also about greater investment and greater access and access for all. Bakari Sonko, if I could come to you. We all think we know, and you hear the criticisms, not just about the Gambia, but about Africa generally, about how little we put towards mental health, but we're all wearing masks.
Yeah.
We're in the time of a pandemic. How is mental health being affected at a time like this?
Okay. Thank you, Andrew, for the privilege, and I'll say thanks to Mohammed for what he has said, which are all real. Now, as far as the pandemic, that's the COVID pandemic. Yeah, there's a lot of challenges, that people are faced with. Even the mere disease condition, which little is known about, and we have seen on TVs and other media houses whereby a lot of people lose their lives. Sure. So the same concepts comes in here as far as Gambians are concerned, the fear factor associated to the pandemic itself, the COVID-19. Now, and there's a lot of family breakdowns, because the family social structure has changed in terms of their job, what they are doing, and they are supposed to provide for the families also have
and also, I don't mean to interrupt, but also we're at a time where, because of restrictions, people are actually having to spend more time than would normally be the case with family members.
Exactly, and there's also another pending issue there. The restrictions make some family members to stay together for a period of time. Now, if you observe, in the normal circumstance before, some of these family members might not be used to that.
Of course.
It's like they live in a working relationship, sort of. Sure. You work from 8 o'clock, then before you come home, it is late.
It's late.
But now you have to stay at home.
Quite.
So that will also bring in other conflicts that they have to adjust to. And then there's also a demand in terms of family members who, basically, they have to go out, fend for what to eat tomorrow. So if their daily means, are being cut off or been compromised, so they don't have that means, to sustain that family. So these are challenges that happen. Even the schools also, but we have seen a discontinuity in the educational system. That's frustrating to some of the students and even to the families also.
Sure. I'm glad you mentioned schools, because I was going to ask a supplementary question, which is that which groups are most at risk about what we're talking about regarding, mental health during the pandemic?
During the pandemic, we can say the most vulnerable will be the elderly people, which are might be neglected within the society, and then even children also, and the homeless people, and especially those who are beggars in the streets. They are very, very vulnerable. Because if the spread of the disease is in the community, whereby it can be airborne and the like, now your main source of earning is go to the streets and beg. So you are more being exposed if you are not following the protocol. But even if you are following the protocols, that contact is there. So they are more likely to have it. Now, there are other people at risk of other complications, because if they have, let's say, cardiovascular disease.
Because we keep hearing about underlying
conditions like cardiovascular disease, or they have diabetics and the like. So if you contract the COVID-19, that makes it worse also. But the psychological aspect there is, let's say that person with underlying condition is going to be more scared to understand that now I have this, I have more potential risks to even die of the condition. So that fear factor alone might even make your life to be shortened than contracting the disease. That's happening now, and that will control that individual's means of even going out, trying to be more protective, to be defensive, to ensure that his safety or her safety is concerned. So now let's say example also is the breadwinner of the family. So what do you do in order to support the family facing all these challenges? So these are factors that are affecting people, and then we understand they are the most vulnerable group as far as the pandemic is concerned. And people who are not employed, especially the youths also, they need to go out, they need to do something, they need to, some have to even go and learn for skills. Now, in the event of the pandemic, most of these we might see some of these activities as unskilled, or they are not essential services. So there is a tendency to stop that. Let's say an ordinary person, a youth man who is selling second-hand clothes in the street. And then there's a time that whereby that was cut off. So that youth man's means of earning has been compromised. So if the person doesn't have any other things to substitute that, so the mental status of that person becomes challenging again, because they don't have the economy to sustain themselves. So then we might increase what we call the dependency syndrome on other extended relatives also.
We might come back to that. Yes, Mohammed, if I can come to you, and after this, we're going to be joined by our returnee, as I had promised. But I'll talk about the International Organization for Migration. Everybody thinks they know what you do, but I just wonder if you could explain to the viewers. what kind of work are you doing in the area of mental health specifically, and in terms of, the psychosocial aspect of mental health in your migration health units?
Okay. Thank you, Adi. At the International Organization for Migration, we have the Migration Health Unit, which is serving various projects, and then we have a key focus on mental health and psychosocial support. It is cross-cutting across almost all the services we are providing. We have the joint initiative, which is AVRR project, which assists migrants stranded in within the Central Mediterranean route to come back to the Gambia. We also have the Peace Building Fund, which is supplementing the activities going on within that project. So our services in terms of mental health and psychosocial support, it starts way beyond returnees coming to the Gambia. As early as they have been identified at the transit centers. I'll give an example of Niger. Niger has a lot of centers wherein migrants that are stranded, they have been lodged there, they have been provided with food, they have been provided with shelter, until logistics are being put in place for them to travel back to the Gambia. So our services provide us early at that stage. We have our IOM personnel that are there. They will screen migrants. They will look at them individually. What are their needs? If they have mental health and psychosocial needs, it will be communicated with us. We start our family tracing. We start engaging the family so that upon arrival, they will get what they are supposed to get. So our services are divided into individual, community and family, and then we also supporting the government of the Gambia in certain initiatives that will empower and support the migrants upon their return. If you look at the WHO AMIs, that is WHO assessment instrument to measure mental health systems, this is a very beautiful tool that looks at governments, it looks at systems and try to see how far they have gone in terms of effective mental health and psychosocial support service delivery. So they look at key infrastructures, whether they are available or not. One is whether they have good mental health policies. Secondly, they look at whether there are available guiding frameworks. Then they look at curriculums, because there had to be globally recognized curriculums for the training of mental health service providers.
Indeed, yes.
So in terms of policy and other forms, we are helping to make sure these things are available. Currently, there is a validation review of a developed mental health framework and a developed mental health curriculum to train service providers. So these trainings this validation exercise is ongoing, and hopefully by the end of the year we'll have it at hand. So this is one part of what we are doing. We are supporting government in terms of policies, in terms of frameworks, and in terms of infrastructure that are going to be recognized by the global world.
If I could just take you back a step or two, you mentioned, for example, in Niger.
Yes.
So are you saying that if there are Gambian citizens who are in Niger, IOM, the Gambia, actually provides direct help? So you register those people and you provide actual psychosocial help for them? Is that what happens?
Yes, this is an international organization. It's a UN agency, so we have offices in various countries.
Of course.
So the support starts way before they arrive in the Gambia. So we have people that start the process while they are still in the stranded areas. So upon arrival, then we have a system wherein it is holistic and ongoing. It's just not a one-time support system. So upon arrival, we have screening. We don't do this alone. We do this with the government of the Gambia. So upon arrival, we do our screening. We screen the migrants again. It's not only for mental health. Not all migrants that come will have mental health problems.
Of course not.
But the tendency is also high because looking at it at a general note, we are Gambians. We have been enjoying the peace and tranquility around us all while. We have been getting the support of our families, the support of our communities. We have been enjoying all the means of our societies together. So all of a sudden you find yourself in a war-torn zone. Every day guns, sound of a gun, every day you're passing dead bodies, and then you come back home. So you will see that the tendencies are high. No matter how strong you are, at some point in time you might start having nightmares. You might start having to reconstruct those images. They will start coming back to you and relieve those. I have seen migrants that when they come back, they tell me, when I'm in my room, I still feel like I'm still in the war zone. I feel like I still hear voices. I feel like I still hear the sounds of the gun. So these are things that are very common when dealing with migrants that have been in these areas. So upon arrival, we do our screening to see those that might need the support immediately or in the long run. So we have a different criteria. These are done by technical personnel with the support of the government of the Gambia. Then ongoing, our support is divided into individual. We try to concentrate on the individual and try to build his resilience. Sure. We try to ensure where services are available, here there's a referral mechanism, or there's a connection of where he needs the service, and he needs to know where the services are available. Sure. And how to access them. And he needs to have the resources to be able to access those services. Sure. So individually, we empower the individual to take over the care or take over their own mental health. And then secondly, we try to empower families, we try to empower community members. We do that through awareness raising exercises, we do that through family mediation exercises, because if you look at the peace building fund, I'm sure I will discuss more about it later on.
As we go on.
We are engaged in, and we try to support social cohesion, and then we try to eliminate all forms of conflict that might derive between migrants and their family members, between migrants and their communities, between families of migrants and community members, because initially I always repeat this, but it has been identified that the perception towards returnees in their communities has been identified as a potential driver of conflict. Right. So through our efforts, we try to build social cohesion and other forms of support system wherein the migrant can benefit and the community members can benefit as well.
Thank you for that. Yeah. Thank you for that very, very comprehensive response there. Bakary Sonko, if I could come back to you.
Thank you.
I think you brilliantly set out for us the kind of most vulnerable, the most at risk, and so on. But if I'm living in the Gambia, I go to my Ministry of Health.
Okay.
What's the Ministry of Health advice in dealing with stress during a pandemic for both somebody who's a returnee and somebody who isn't a returnee, just for everybody, because we're talking about mental health and mental health well-being for all. Yes. So what would the Ministry of Health's advice be?
Yeah, the advice is simple. First, the first line, as far as the pandemic is concerned, we have what you call the 1025 lines that people can call. And then there is where they will start, by telling us, whether they have emotional issues that they want to deal with, or they are having challenges, or, they cannot sleep, or they are having some, let's say, anxiety-related issues. Then they will be referred to the mental health service providers. We have psychosocial support service providers. I personally lead the psychosocial support subgroup at central level for addressing mental health, and psychiatric conditions that might be arising because of this COVID response. So in order to address that, we created what we call an intersectoral group. And then we make sure that people have the capacity to provide psychosocial first aid to the people who might request.
And what does that sectoral group comprise?
Yeah, psychosocial support group, coordinating group. Right. So that group is existing, and as a result, we make sure that people coming from, let's say, NGOs, other organizations, individuals, are identified who are providing services related to mental health, like Organization for Psychosocial Innovative, IOM, as an example too. Yes. Then we have WHO there. We have UN groups like UNFPA. Then we have even UNICEF also as part of it. We have Department of Social Welfare. Then we have other community-based organizations like SAF, supportive activists. Then we have MOBE for mental health also in the Gambia. There are a lot of organizations which come in. We have a composition of about 35 different organizations which come in. And as we are speaking now, we make sure that these people are being provided with some basic knowledge in order to provide these services, which is partly also sponsored by IOM.
Sure. And you mentioned the 1025 number, and I just was thinking about if somebody is concerned about a friend or family member who they think might be having mental health issues.
Yes.
How does one approach the Ministry of Health in that sort of situation? Is that the number to
ring?
Yeah,
that's the main number for all emergencies in terms of the COVID.
Sure.
Although we have other numbers also which are specific.
Which are not.
Yes, like the 1313 for gender-based violence. Yes. Then we have the 199 for child, related to child abuse and offenders and the like. We have those two numbers also available. But the most important number here that we are sharing as far as COVID is concerned, because we went through these issues too, in order not to confuse people. If we give a lot of numbers that they can call, that's going to bring in a lot of confusion.
Of course.
So we have a one number that anyone can call in and their problems can be channeled, through that number. Like there is a call center existing, whereby people are there 24 hours, provide services, so they know wherever the persons, there's a screening checklist. The more you call and they look at based on what you're calling them for. So now if they had been challenged and then they are concerned about somebody, or because emotionally they are also involved, or family member dies,
Indeed,
related to COVID, so what do they want to do? So this is where the helpline is important.
Sure.
So we create those helpline also to provide psychosocial support. Sure. Now, in the event, the person is identified, and then the person cannot come, and then the psychosocial support officers are the ones who are going to be going there.
Right.
So within the structures also, we have the rapid response team, within which you have a mental health and psychosocial support officer. You have contact tracing, you have a mental health and psychosocial support officer. At the points of quarantine and treatment center, you have mental health and psychosocial support officers. These are completely different from the ones which are also at the mental health unit. So that, we can have a diverse approach to the system. And this is available across the country. At the regional levels, we have a mental health focal person there to provide these services. So it's not only like you say, tanka psychiatric unit, but we have hospitals which also have psychiatric units there, like Kanifing General Hospital, Farafel General Hospital, Edward Francis on the Polyclinic, and then Bansang also. Even Basse, the district hospitals also have a mental health focal person. So these people work in collaboration with the organization. We are all part of the same group, and we make sure that we have this WhatsApp group that we can share information. Then we have the social workers working hand in glove with us, and that of the Red Cross volunteers also, who also join hands in order to help in community approaches. Because another one key important thing is, as far as the pandemic is concerned, we happen to realize that some people die related to COVID. So you need to have what you call dignified and safe burial. And whereby the Red Cross is doing that, now we make sure that they are also provided with some emotional support. The service providers themselves, you see, we cannot provide the services if we are not emotionally stable. And one vulnerable group that we forgot to mention was the healthcare providers and the service providers themselves. We are at more risk than any other person. No matter what, you can stay at home. You said, okay, it's not my job. But for us, maybe we are the human sacrifice. We need to be there. So that fear associated to the fear of even having the infection, or a colleague of yours happened to contract it, and the person passed away. So now there's a high risk that we are also going to have that. So that might lead to a lot of behaviorals. Because we are thinking negatively. You might say, okay, now when they call you for your service,
am I next?
Yes, but you can even dodge by saying that I'm sick when you are not sick. So these people also need that psychosocial support. So it's not only the people who contract it, neither the people in the community, but the service providers themselves also need that psychosocial support as far as the ministry is happening. So the ministry coordinate all these activities in conjunction with other partners in the system. And for the media houses also, we won't forget you, because the more the adverts are not happening, they are not in the radios, then people will not be aware. So that's why within the Rex communication group also, we have a psychosocial support officer there. So that some of the messages, we look at them, we know that they are not emotionally changing our mind. It's not also making us not to lose hope. Example, messages like, COVID-19, you have it, you die. Now, think about it. No cure for it. So nobody's going to listen to you people now talking. But if the message goes, COVID-19, yes, you are elderly, you are at risk, but there is treatment for it. And all people who are elderly do recover from it. Or people contract the disease, but at the end, they can also recover from it. So you saw the number of recoveries that is also related. That gives hopes to people. But if we continue to say, COVID-19, dead, you have it, you die, what's happening? We create more anxiety among the community. So that's why it's also important the messages are looked into so that they become socially acceptable and they can give hope to people. So this is what the ministry is doing. And the mental health unit there is not only looking at the mental health aspect. We look at all the service deliveries within the system to ensure that mental health is integrated so that it's not an outside thing. Now, let's say example, the one on doing surveillance. So those surveillance officers are going to identify people coming at the points of entries. One example. So at those points of entries, there will be a holding center for a suspect. So that suspect, before the person is evacuated, you need emotional support there. So you need a psychosocial support officer to come and talk to that person, the reasons why it's being held, and the others are left to go. What kind of services the person can expect? What is the likelihood that if the samples are collected, they are positive? What are the benefits there? If it's negative, what are the expectations? And even at the hospital level, which have also isolation centers. They are also, before they are sent for treatment centers, the results is not positive, but they have certain symptoms. So they are isolated. Then the psychosocial support officer need to be present there also to provide service to these people.
Thank you for that.
And that's case management. So within all the various sectors available, mental health and psychosocial is part and parcel of it. It's like discussing about a human being. You forget the head.
Yeah, quite.
So
it's all part of it.
Thank you.
I mean, Mohammed, I just wondered if there anything, before I come to you on a specific question, whether anything that Bakary has mentioned that you wanted to pick up on or amplify. If not, I have a specific question for you. And really that is about the impact of your work in terms of, you know, community stabilization, peace building. You mentioned the Peace Fund and so on, social cohesion. I mean, those are very much part of your remit. So how is your organization actually, what's the impact of the work that the IOM is doing in respect of those?
For the past 2 or 3 years, I am assisted almost 5,000 returnees, Gambian returnees, back to the Gambia. And all those returnees need to be reintegrated back into their societies and communities. They will need various forms of support. And now, moving forward to this COVID pandemic, we have all seen the fear and anxiety going around, which can graduate to any form of a severe psychological disorder or a mental health proper mental health problem. So we have seen, looking at those 5,000 migrants, each as an individual will have needs that are based on his or her individual
specific needs,
experiences.
Quite,
So moving forward, we have to try and make sure those migrants are holistically integrated, not only the economic assistance that are being provided, but we have to ensure they are able to live with their family members, they are able to continuously live with their community members. So what we are doing is one, capacity building. We are banking a lot on capacity building. Even currently, as we are speaking, there is a training going on for Tanka Tanka Psychiatric Hospital. We are training the staff of Tanka Tanka Psychiatric Hospital, and we have volunteers on mental health and psychosocial support, wherein we are also mainstreaming IPC, infection prevention and control. So the capacity building exercises are there to strengthen the infrastructures available, the institutions available to provide the care needed whenever they are called upon. So that is one. Secondly, right now we have scaled up our work, and then we have included some form of innovation. That is what we call virtual counseling. We are providing virtual counseling services.
How does that work?
It's a telephone conversation. Telephone conversation. It's counseling, but it's done over the phone. So we even speak to Gambian migrants that are stranded in other countries. We speak to them on the phone, and then we have counseling sessions with them, and then we help them to make decisions, help them to start to take initiatives that will promote their mental well-being, or even help them to make decisions that are concerning their return and moving forward. So the other thing is we are also scaling up our support to already arrived migrants. We have a lot of migrants that are yet to receive their reintegration assistance as well. And we have scaled up the number of activities we are doing in terms of community outreach services. The COVID pandemic has given us a lot of, there are a lot of restrictions that's in terms of social mobilization, community engagement. So because of the restrictions in terms of how many people can gather in one place at that point in time, and the amount of control we can have over people concerning the putting on face mask, and then following the right procedures are recommended by WHO and the government of the Gambia. So we are entitled, we have tried to engage in capacity building, we have tried to support the country's institutions, and we have seen that in terms of social cohesion, our community outreach programs have supported a lot. Because if you want to change behavior, we need to increase literacy. We need to increase the literacy behind certain things. People are scared of what they don't know. So if you see the perceptions around returnees, it's because people don't know what they go through. They did not experience what they went through. And then for families, sometimes you cannot blame them, because these are the natural expectations.
Of course, exactly.
What they are seeing on Facebook, what they are seeing from other households. Their children went to Europe, their children went through the back way or the illegal route, and they went to Europe, and they are sending a lot of money. They are doing a lot of developments. So they are imposing those pictures on their child. So if their child comes back from this way, and then you tell them that I was assisted to come home, I didn't even have the funds to come home. I was assisted by IOM. You see, their dreams are already shattered. So there has to be that mediation efforts for the family to accept their son or daughter back. So if there is no, some families, some migrants are lucky. they come back to families that are happy to see them. Sure. Families that are even go to the airport to receive them. Yeah. But some migrants are even scared to face their families again. Yeah. So we are engaging in a lot of those mediation efforts through our community outreach programs. We do a lot of awareness raising exercises. We have seen migrants being supported.
Well, I was aware of migrants as messengers,
yes,
and we were hopefully going to talk about that because on the previous program we spoke about that. But if I could just come back to you, Bakari. Mohammed touched on it there, and the thing about stigma, and again, both of you have in different ways mentioned it. But what are the ways that we can address social stigma, particularly the ones that have been imposed by the pandemic? I mean, what Mohammed was just talking there, if imagine somebody has come back, they've been assisted to come back, and then because of restrictions, they're actually having to spend a lot more time with their family than they would be comfortable with. They might have wished they could go out and be away from the family because of, the shame, etc. that they might be feeling. But what are the ways that we can address this? What are the ways?
There are many ways, that can help us to address stigma. First is acceptance.
Sure.
We have to believe that not all that glitter is gold. Now somebody can go back way or through the right way to Europe and become successful.
Sure.
Somebody also can go through the right way to Europe and is not successful. Just like the one who has gone through the back way. So it's important we understand if our wishes are left to us to decide in terms of based on our actions, there will be no failures. So at times it's a learning process for us. Now why is it that some people are being rejected by family members? There are a lot of factors surrounding that. Those the family spend their main means of living to ensure that this person goes. Do they borrow money from another family member or somebody?
Which we hear about.
Or sell their home. And then they bank on this individual and the person has gone. So when the person comes, the person might be seen as a failure. So that failure situation will make them not to even associate with him or her. So with the family members, even with colleagues. So that's going to disturb the individual, and as a result, the person will be isolated.
I mean, I've even heard somebody who I interviewed say that he was forced to move away from
the family. Because exactly. So because the acceptance is not there, and acceptance can only come in if the awareness is there. The person needs to be educated more. He mentioned the literacy level. You need to come in. The more we educate each other, the more we are informed, there's likelihood there's change in behavior. Learning supports that. So the more there is a positive learning there, and then our mindsets are changed, then there will be positive behaviors coming in. And then the person who also comes in, we have to understand that person needs support. You don't have to reject that person, and we can applaud IOM and other institutions doing that. Now, if the person is able to regain and by his own drive now and is able to do some businesses, become more productive now, and he become functioning, then he can even come and help the family members again. But if all those means are not there, now that person's rejection might increase, and then there's a dependency syndrome there. So who is going to support this person who has come in? So the more that is not happening, then you look at that social fabric also. What is the other community members looking at these people at? Conflict of interest. You see? So they can be scapegoat.
Indeed. I mean, in terms of sort of getting rid of the stigma, helping, whose job is it to educate? That literacy that we're talking about.
All of us. It's everybody. In approaching mental health issues, especially pertaining to stigma, there are a lot of fabrics involved. Our own mindset towards the situation, the person who has been stigmatized, does he contribute to it? Or the family member, or the community, or the educated people, what kind of information are they sharing? Or the media houses, what are we seeing? Now, example, if we are saying that somebody went through the back way, is successful footballer abroad, now that you are motivating other people or informing them to take the back way.
Yes, indeed.
Now, if you also saying us that the danger associated in the media, the ships capsizing, a lot of people are dying. That's also creating another fear for another group also. So we are all part of it. So all of us can do something to inform the other person. Now, you cannot destigmatize you as an individual because it's not done by an individual alone. So there are a lot of people who are putting that stigma to this person, who is going to feel inferior, he's going to feel that he cannot do anything. So the person's own mindset, does it have the capacity to resist these things? Does it have a better coping mechanism So that it's important for you to understand that the way you behave, you're returning home, doesn't mean that that will change the behavior of other people. Yeah. So you have to accept who you are first. Sure. Then to be able to accept that this reaction from coming from these people is expected. So, but how you respond to that reaction will also affect you. So the more you accept it, then you start approaching them. Now, then that will start to make a U-turn now. But if any reactions comes, you're encouraging it by moving away or trying to avoid them. One day you're going to meet them again. Indeed. You can avoid, but at times you cannot avoid. You have to avoid and approach. Then you avoid and approach till you are able to solve the problem. But if the family members or any person in the community is scapegoating you, then your own mentality towards that person is important. So you, the person being stigmatized, is one, and the people stigmatizing is two. Exactly. What information do they have is very important. Those informations makes them to change that behavior. So, and that can only happen if we accept each other that at times we are not responsible for failures. If we know that somebody who fails in doing one action and the person learns better from it, the person can be able to prevent that from happening. Failure in one aspect doesn't mean total failure in life. Okay, you can have shortcomings. Of course. But those shortcomings, if you make sure that these shortcomings are the ones that are making you not to strive again, then we know that you are mentally challenged, because it will make you not to function as expected. Indeed. But if you are able to function from there, which we want, but stigmatization is making the people not to function, and it can make them even more irritable. It can lead to violence, crimes and the like, and family conflicts, because if you provoke people, they will react. Of course. And every bit of action, there's a reaction. So if the negative reactions follow, this person will be disturbed. So it's important that we emphasize more on community's engagement and sensitization than family engagement and sensitization. At times you cannot approach the whole community, but you can meet the family. At times the individual you can meet also. I think we're about to be joined. A big responsibility.
Thank you for that. I think we're about to be joined by our guest. I did say that we would have another guest who is a returnee. We've heard about stigma. We've heard about, all the things associated with, coming back. And this time I think we need to hear from somebody who's been through that journey, who can actually give us first-hand experience of it, what's it been like. Because, for the rest of us, we can theorize. And I'm glad that Bakari said that, all of us have a part to play in this. Because again, I talked about the World Federation for Mental Health, and I said that, they're talking about mental health for all, greater investment, and they also had the theme of greater access for everyone, everywhere. And so I'm glad to welcome to the program Absa Jallow. You're representing, we've spoken, I think, previously on Zoom, Migrants as Messengers. Welcome to the program.
Thank you very much.
And so if I can just kind of wheel back, you've heard some of the conversation whilst you were sitting at the back there. If you could just give us in brief, because we're kind of running out of time, but just summarize your experience about why you left and what your experience was of leaving.
Yeah, the reason why I left was because of the family background, just to go and then get a better life and come back to take care of the family. And during the journey, I have a lot of experience on the road. I've seen a lot, and then I've heard a lot, and I've gone through a lot. Yes.
And was it your own decision to return? Did you return voluntarily, or did something happen that made you, that they were able to facilitate your return?
Yeah, because of the conditions that I found myself in Libya, it was not favorable. So I decided to go to IOM and then request them to bring me back to Gambia. All
right, thank you. Now, before you came on, we were talking about how people are welcomed either by their friends, their family, or the community. I wonder if you could tell us something about your experience of how you were welcomed when you came back.
Anyway, the way I was welcomed was good, but then the background itself wasn't good. Because if we come back to Gambia itself, when you come back from Europe or any other, even if you are just from Senegal and you come back, they expect something big from you. They expect you to give them something. They expect you to come with something. And if you do not come with that particular thing, they see you as a failure. And what I brought was my son. Yes, and what people said was, she went there just to get married, she went there just to get a baby and come back.
I mean, you said all you brought was your son, but that, I'm assuming in time everybody accepted that.
To me, it's a big priority,
exactly.
yes.
Exactly.
But then the way the blacks are seeing it, it's different things.
So psychologically, that sort of rejection, that sort of non-acceptance, how did it affect you?
It affects me a lot, because sometimes when I sit alone, you try to think of the past, you try to think of what you have gone through just to make your family a better family. And then at the end of the day, you come back home and you have been stigmatized, you have been run away, you have been thrown words upon. It's painful.
I'm sure.
Yes.
So Mohammed, that kind of nicely leads into what my next question was going to be. What is it? What are the positive aspects of the work that the IOM is doing to support APSA or somebody like APSA? Can you give us an example or examples?
Okay, thank you. Before I come directly to your question, I just want to add some little on what Mr. Sonko said. To start with, we are not discouraging people from traveling. We're just encouraging people to travel in a safe and dignified manner.
Indeed.
Coming back to the question, we have all heard APSA's story. This is not coming from me, this is not coming from Mr. Sonko, this is coming from someone who experienced the journey. So this is what happens. And then when they come back, they will need help. They will need help from their family. They will need help from philanthropists. They will need help from organizations like IOM. They will need help from the government. They will need help from their friends. So there are a lot of migrants out there that experience the same events that APSA experienced. Some are male, some are female, but they all experience things that are quite likely. But what we have done is we have tried to make sure the communities they are going back to, we reach out to those communities so that when they get there, things are already working. Because what happens is, if the community rejects them, one, they will start having negative coping mechanisms. They will go into drugs and substance use. They will run away from their families. They will try to seek help wherein they will get abused further. So we need to prepare the grounds before arrival. So there has been a lot of sensitization exercise. Even the MAM project, that is the Migrants and Messengers, she's part of the volunteers. They go out there, they sensitize the public, talk to the public, and tell them their stories. And it's a they offer peer-to-peer influence. Because if you see most of these migrants going through this route, it's peer-to-peer influence. One of my friends went, they saw the pictures on Facebook, it sent to you on WhatsApp, and then also take the journey. So they go out there and explain to people that it's not really gold out there. There's a lot of things going on around the journey. So we have been going around and trying to sensitize the public to raise awareness around this issue. And then most of these migrants that have been assisted to come home through the joint initiative, they have been provided with socio-economic assistance. They have been provided with businesses. They have been provided with entrepreneurship training. They have been provided with other forms of training wherein they can apply their skills and it will be a way of earning income. So
just finish your
so
point,
before if you see youths are going through this route, it's because they are not having returns, they are not having income. They are not being engaged in activities that will bring income to them. So they feel there is no other choice but to take the risky behavior. But then if they are supported in a way they start earning, then the problem will likely be eliminated. So we have to continue, people like organizations like IOM, the Gambia governments, to do more investment in the needs of youths. And look at the theme of the year. There should be a scale of investment in mental health. At a global consensus, we have seen that the governments are spending less than 2% of their expenditures on mental health. We've talked about what the world is losing in terms of trillions of dollars yearly due to mental health conditions, and the growing number of mental health cases. We can look at the global burden. It's going higher every day, and because of COVID-19, it will continue to go higher because people are continuously being scared of what is going to happen next. We don't know what is going to happen next. Experts are still researching. They don't even come up with a vaccine yet. So people will continue to be scared. There will be anxiety going around, which will graduate at any point in time. So there should be investment in all these things. So,
Thank you for that. Now, the reason I wanted to interrupt Mohammed and come to you, APSA, is because Mohammed has spoken about the work that the IOM has done. And I just wondered, we talked about migrants as messengers. How and why did you get involved in that? What made you want to do that?
What makes me want to do? First of all, before we get into these migrants as messengers, personally, I normally go out with IOM to go to the communities, sensitize them. And I've seen the way that I try to sensitize people. Women are complying with me. Women are coming and then asking me of the road, and then some are even telling me that they lose their sons, they lost their daughters on the road. So I see it as a way of saving lives.
Right.
I see it as a way of saving my brothers and my sisters, and that is why I went into these migrants as messengers.
Okay, thanks for that. Now, one of the things that I've always been kind of banging on about since I came to the Gambia is the kind of, that education in schools should be broader than just reading, writing, and arithmetic.
Exactly.
We should educate our children about various things. So what steps are your ministry taking about promoting the idea of mental well-being across the country?
Yeah, the best way we are doing it is continuous sensitization through radios and TVs, to talk to people about mental health and mental illness, because this is very, and substance use also, so that people know mental health, for you to be able to function in a given society, based on the norms and values of the society, to society's expectation also. So morally, mentally, socially, you are able to function and become productive. Now, if people are challenged because they have issues, they cannot do that. And that function is compromised. So they either substitute to use of drugs and substances, and that is making them not to function in order to be responsible people tomorrow. Now, if they have mental disorders also, that also have a lot of burden on the economy. Mohammed mentioned that if we don't invest into that, then we are going to invest in caring those people. So, and in caring that is going to be another costly. So you don't have the human capacity as required. So there needs to be more training, and this is what we encourage. And as a result, in fact, they are one of our graduates, as far as ministry is concerned. Though on a limited scale, but there's a training component. We ensure that all the health training institutions in the Gambia have a mental health module. All right, and you have that there. When you're doing the nursing programs, those are doing the medical programs, there's a module on mental health. And now that we also have a mental health specialization, bachelor's level, in one of the private institutions like the American International University, to encourage people to come in. Yes, we are challenged as a government in terms of financing those things, so that more specialization can come in. But the most important thing is we already have a national mental health policy with a 5-year strategic plan.
Now you say 5-year strategic plan.
Yes.
None of us planned for COVID-19 and the coronavirus pandemic.
Yes.
And I actually was going to ask you whether that has changed everybody's plans, including those of government, as adding it as a component, because it's what it's forced us to do.
If you look at national plans, especially mental health and the health plans, there is a component of health emergencies, emerging health emergencies. So we are not prepared per se for COVID-19, but it doesn't mean we don't have these emergencies in our structures. So we have what we call National Disaster Management Agency.
Indeed.
All these things are there to look at some of this potential or likelihood that they will happen. All right, so we have them captured, within certain, policies and the like. So as far as mental health emergencies also are concerned, this pandemic, we look at what are the basic needs that are being compromised, the mental status of the people who are going to be involved, and then look at the components in terms of that. There is a key area which is mass sensitization and increased enlightenment. So this is important that even in the plan that is captured there. So that enlightenment component, if we want to make it broader, then it becomes specific to COVID-19. So that is why that COVID-19 mental health psychosocial support group exists in order to address that. So there's what we call COVID-19 psychosocial support plan, activity plan, that is there. And then that plan also is supported by interagency plan for mental health response, so that we look at what are the basic things that we can provide during this COVID-19. One, we are able to give education to people or inform them through sensitization. We are able to give physical support in terms of food items to people who are directly affected. Even like you are at quarantine, your family, you are the family head, and then the family is not having the means, like food, basic foods. Some family members, we are supported with that. Some we are supported with some cash to give to the family, because the breadwinner is on quarantine or is on treatment and cannot provide to the family. So we have, through the cooperation with social welfare and UNFPA, we are able to even provide some services for these people, both morally, emotionally, and then financially also. We provide those services as far as COVID-19 is concerned. And that comes from the plan for psychosocial intervention in COVID response, in the COVID pandemic. So we know this is there. Now, there's what you call unexpected emergencies. So nobody's prepared for those things.
Exactly.
So then human being, as a social being, always adjusts when circumstances come.
Indeed.
You know, that's why we have brains. You know, we can reason, we can come together, and this has happened through engagement of other players, so that we understand the Ministry of Health is not the only institution in the Gambia. All other ministries are part and parcel of this response.
Exactly.
All institutions existing, all individuals, even if you are not a Gambian but you are in the Gambia, you are part of the response. You either contribute to increase the problem, or you contribute to mitigate the problem. One way or the other, or both. Because what is happening here is, let's say example, Madam, welcome on board. Her challenges. We have created a situation whereby voluntarily we will take numbers, full numbers of volunteers, and then we give volunteers our numbers. Even through with IOM, we share this information so that they can voluntarily even call in the event they want to be talked to, because we can't initiate it. You see, in psychosocial support, the service user need to have that.
Of course.
All right? If the person is not mentally disturbed in such that he's not functioning, then the person have the brain, have the intellect, have the cognition to reason and adjust, then that person will identify the need that they need to talk to me because of my anxieties, and so that we are not imposing. A mere interaction have what we call stigmatization in terms of who is that person. That is Sonko speaking. You're going to him, are you mentally sick? So they will identify Sonko and mental health problems. So now it's better for the person to maintain his or her privacy, to contact us voluntarily. Even when we do TV shows, that's what we say. Call us voluntarily. We will not impose it on you.
Okay, let me come to...
Another one I want to just put there, as Mohammed said, wherever they are coming from, their points of entry, like let's say from the Libya or Niger, if they have a mental health problem there, we are linked. In Italy, they are coming, they have mental health problem, we are linked. We want to know what is the medication, what is the condition, what are the supports available for that person. These are called special needs people among the migrants returning also. So those with physical conditions, those with mental health problems, and those doesn't have any identified potential problems as of now. These are separated also at the point of reception also.
So can I, if I could come to you, and we have to be quick because, as I said, we only have an hour for all of this. And I have to come back to both of you gentlemen as well. But how have you maintained a kind of positive mental health attitude in all that you've gone through? How have you managed to do that?
I've been managing anyway, sometimes stay indoors. Because my happiness is my son. Always with my son indoors, watching TV or playing some games for him. That is how I take away all my thinkings and then my worries.
Okay.
Yes.
Thank you for that. Now, we're talking about World Mental Health Day, and we have to be brief. Time is running out. But we've got this program, which is going out on the day. But also, what other activities, if I could ask, I am going to be involved in commemorating and celebrating this day?
Okay. For the past years, generally, we for the past mental health days that we are celebrated, there was advocacy around dignity in mental health in the workplace. We talked about depression. We talked about mental health and young people in the changing world. And this year is a scale of investment in mental health. Indeed. So we are going to engage in a community bantaba. After this program, there will be a community bantaba in Bullock, that is Foni. We will engage the community. These are selected communities that also accommodate migrants. So we will engage them on a community bantaba session. And secondly, we are going to Tanka Tanka. Tanka Tanka is the country's only inpatient psychiatric treatment.
I might have to stop you there because I'm sure there's a long list of things. But if I could come to you again in 30 seconds. In terms of the Ministry of Health, what are you doing, and how can this day actually contribute to people's mental health well-being? And if you could also allow Absa to have a final word, possibly. But first,
okay, thank you. Now, for us, in the commemoration of mental health, we engage all partners, and even business agencies to know that, their investment in mental health is as key as a specific invention in any of the programs they are doing or activity. because any activity they are doing, they need the human force. And if you don't have a mentally stable person for your department or institutions, then your program or activities is likely to fail. So that's a big investment there.
Absa, I leave the final word to you. Just in a sentence or two, what is the message that you would like to get out on World Mental Health Day?
Just to speak to people, to stop stigmatizing people that are coming back from the back way. If you stigmatize somebody, you are troubling the person, you are increasing the health to be worse than it was before.
Thank you. Thank you. And that's a great note to end on. And I'd like to thank the last speaker there, Absa Jallow, Migrants as Messengers, and to my immediate right, Bakari Sonko, National Program Manager for Mental Health with the Ministry of Health, and to my immediate left, Mohamed Toure of the Regional Integration Assistant with IOM. And signing, of course, as ever, Mr. Lamin Sonko. Thank you for watching. And please, as I said at the top of the hour, let's use the day to pause, to think, and to reflect about all those who are dealing with mental health issues. Thank you for watching.